Hello and welcome. I'm really pleased today we have Michelle Oretse Jaffor with us. Good day, Michelle, and how are you?
Good, thank you. Thank you, Rudy, for having me today. So I'm the Study Participation and Inclusion Senior Manager at the North London Regional Research Delivery Network.
Let's get started, Michelle. Please outline the vision and mission for the North London Regional Research Delivery Network.
Yeah, sure. So we are the North London Regional Research Delivery Network, also known as the RRDN for short. So we're part of the wider National Institute for Health and Care Research, NIHR for short. And we're funded by the Department of Health and Social Care. And that is to enable the health and care system to attract, optimize, and deliver research across England. So the NIHR Research Delivery Network is made up of 12 networks, of which we are one in North London, and together with the Coordinating Centre, which is our national team, and the Department of Health, we have a joint leadership approach. So yeah, just a bit about the vision. So as a network and as part of the wider UK infrastructure, the aim is for the UK to become a global leader in the delivery of high quality commercial and non-commercial research that is inclusive, accessible, and improves healthcare. As a result, research will reach more people and address the changing population needs, and also support the health and care system and the economy, and just become part of regular care. So about the mission, so that's enabling the health and care system to attract, optimize, and deliver research across England. We do this as part of the wider National Institute for Health and Social Care Research overall mission to improve health and wealth of the nation through research. Yes, so there's current sort of policies highlighting the importance of moving healthcare from hospital to the home and community, analog to digital, sickness to prevention. So these are all areas that we are very heavily invested in, and also the research needs to reflect this shift as well to ensure healthcare is equitable and accessible for everyone.
So, why are you supporting the Faith Research Network through the Academic Community Research Implementation Program?
Yeah, so this is an initiative and a year-long program to create a North London faith-based research network. And it's a collaboration between us at the North London Regional Research Delivery Networks and the existing Academic Community Research Implementation Program. And we have a very diverse population in North London. So we want to ensure that the research and the resulting healthcare is available and effective across the whole population. So with this new network, we want to explore the role of faith in healthcare and research. An example of this is during COVID and the COVID vaccine rollout. There was hesitancy from many faith communities that we found, and that was based on components of the vaccine containing sort of pork gelatin and materials that weren't culturally weren't considered to be culturally sensitive or represent different faith communities. So these are kind of insights that we need to recognize more often and actually act on. And we want to work with faith communities to ensure that we have inclusive research from the start, and just to make sure it's culturally adapted and actually reflect the faith groups that we have in North London.
So, overall, what are you trying to achieve?
So our media aims will be to have faith leadership input into the 7 key areas that we've highlighted. These are areas that have been long known to be priority areas in our communities, and they are maternal health, youth, and children, multiple long-term conditions, and also the workforce as a cross-cutting theme across all of these areas. We also do have a focus on 3 disease areas, which are sickle cell, mental health, and prostate health as well. So at the moment, we're looking for appropriate researchers and appropriate studies and opportunities to feed into these 7 key areas that we can work with our faith advocates and leaders. And we also want a strong focus on the workforce, because we understand that the community is the workforce and the workforce is the community. And there's lots of good work already happening by many members of the NHS, which are also part of faith groups and have that reach as well. So we want to recognise the good work that's already happening here, and just engage this and further work with our faith communities to highlight and amplify the voices and recognise the wealth of knowledge that we already have within the NHS system and the potential to expand on this as well. We also want to make sure that healthcare is equitable and culturally adaptive from a faith perspective, and anything more that we can be doing in the space. In the short term, we want to build on and enhance trust between our faith communities in North London, and also between the healthcare and research institutions as well, to have regular communities of practice, training sessions, workshops conducted for the faith leaders to become our faith research advocates as well. So yeah, essentially across North London, we want to have consistent approach with the long-term aims, and develop churches and other related religious organisations into faith research hubs to create a sustainable model for ongoing community-led health engagement as an integral part of our research development as well.
So what type and levels of training and development support will be available for the faith research advocates?
So our aim, so we definitely want to strengthen our faith leaders' capacity to advocate for evidence-based research, and evidence-based health policies via research. And we want to be able to connect them with researchers that have had their input, and have their input into funding applications at an early stage of study development where there can be maximum inputs. We understand that faith leaders and advocates are well placed and informed about the needs and what needs to be done for their communities. So we want to be asset based and recognise and build on this, and on the strengths and assets, rather than approaching it from a needs and problems base. We also want to enhance this knowledge with the skills and research knowledge specific training, to provide awareness of the suitable studies that we have in North London, and also enable them to hold conversations to communicate about health and social care research in the UK, alongside healthcare and other community and social problems that happen as well. So the program model that we have is quite broad, and we want to be able to adapt that and implement it in a flexible way locally. It also allows for ownership and decision-making power to remain within the people and the communities, who obviously are best placed to advise us about when, where, how we deliver this program successfully in the area. We also have an inclusion team within our research delivery network, and we're here to support the faith advocates to be actively involved in the program, to make sure they have the right information, the right resources, and anything else they might need. We also conduct training, obviously, with an overview of us as a regional research delivery network and the NIHR, just to gather and also support gathering insights on health and care research views, and identify local information as well, to make sure they're equipped for their role. We can agree as well, establish a local, agreed ways of working in each of the local areas, and provide more opportunity for peer support, which we find is very important as well. And also define some clear aims for the programme within our community partners and research advocates from the outset as well. So our aim is definitely to have our faith research advocates work with us for research delivery in North London, and develop and deliver training or training manuals for health professionals as well. They can input into that, which will help influence policymakers and key agencies as well. We also definitely want to promote awareness of our service, which is called Be Part of Research, which is a platform where the public can find out about research studies that are suitable for them and are in their local area, and also Join Dementia Research as well, which is a platform to find out about research in the dementia portfolio as well. So we want to help them and support them to take these to their local communities as well and support us with this.
Thanks for that. So finally, what are your thoughts on how North London Regional Research Delivery Network can promote inclusive communication? And of course, what we mean by that, the means of communication may be different, but the needs are the same. That ensure that public health messaging reaches faith communities effectively, and support the move towards appropriate language and channels.
Yeah, thank you. So within the North London Regional Research Delivery teams, our inclusion team, we work with, many of our communities, and our aim is to build that long-term trust. We understand that senior faith leaders and faith members are the primary catalysts for engagement and supporting the development of the faith research advocates as trusted messengers within their local churches. We hope to set up our faith research hubs in the long term, which will be supported by the community and also us as a regional research delivery network. We also want to work closely with other trusted settings as well in the community, such as schools, community pharmacies, where many people of faith, of course, also interact with as well. So we want to definitely build on the knowledge already that is happening in the faith networks and the strength that they have in connecting with their community. Some key areas is that we want to be reciprocal and non-tokenistic. So our engagement will obviously be two-way. We want it to be mutually beneficial, and want to keep our communities informed throughout. And our faith research advocates will be key in this area as well. And we also want to take on board the advice that we're receiving from our faith research advocates, from our communities about the research and healthcare that they're receiving. We want to be flexible, listen and adapt to the ways of working in our new regional research delivery teams. We want to adapt to the way healthcare is evolving and how people are interacting with research. And so we want to be open and accept any kind of different new ideas, innovative ways of connecting with our communities. And we also just want to be brave. We want to try new things and new ways of working, like I've mentioned. So the ultimate goal is to maximize the impact of research through what is known as knowledge mobilization. And so knowledge mobilization is about sharing research evidence and information widely with the people and the communities who are able to use it. And it just helps create new knowledge and positive change. Often we hear that research participants, they report that they don't hear about the results of the research they've taken part in. And we understand, that's kind of that if that's someone that hasn't taken part in research before, that's quite a big step. And then to not have any research outcomes and feedback is quite detrimental to their experience overall. So we want to work with communities and build the links with the organization and the individuals with the help of our faith research advocates who have already strong networks in this area, so we can avoid this and actually use the knowledge and mobilization tool that we have very impactful in North London.
That's excellent, because it also means then that we can really build on the social prescribing aspect of the broader voluntary community faith and social enterprise sector.
Absolutely.
And be an integral part of the wider thriving communities agenda.
Absolutely, yes. And we very much support that way of working and want to work in that way as times are changing now and priorities are shifting towards that.
Thank you very much.
Thank you.
Good day.
Thank you, Rudy.